for YouTube as well. So, okay. Good evening, everyone. Thank you for joining us for another edition of Facebook Live with Jefferson County Health Department. This evening, our video is going to focus on the COVID-19 vaccine information. There's been a lot of information out there, so we're going to provide some basic information just on vaccine logistics, specifics on the Pfizer and Moderna vaccine, and then also address some of the questions that y'all have been sending in for the last couple of days. So give me one moment here to share our presentation. And let me pull that up. Okay. This should be up and running. Perfect. Okay. So there we go. All right. So COVID-19 vaccine information is what we're going to go through today. So just to give you a quick update on who's on the live. I'm down here at the bottom. My name is Brianne. I'm the communications specialist with the Jefferson County Health Department. I've been in public health for over 4 years, and I have a background in education and communication. Melissa?
Hi, I'm Melissa Parmalee. I am the clinical services manager at Jefferson County Health Department, and be talking a little bit about the clinical aspects of the vaccine, and been in public health for 3 years, but have spent a large portion of my time in clinical laboratory services and clinical lab science.
Perfect. Gina?
Hi, I'm Gina. I'm the Preparedness Coordinator here at the Health Department. I've been in this position a little over 5 years. Part of this position is making sure that we have plans in place for public health events, such as what we're going through right now, looking at those large scale vaccine dispensing. So we'll talk a little bit about that today.
Perfect. All right, moving right along. So this is just an outline of what we're going to go over today. Again, the vaccine logistics, a little bit of information on mRNA vaccines, just because those are new. There's a lot of information out there. Info on the Pfizer specifically, then Moderna will answer your questions. And then we also have additional resources that we can provide as well. So these are kind of just the basic things to know for the vaccine. Was this?
Hey, this one.
Okay, sorry.
I was moving so I can see everything. So one of the most important things to know is that at this moment, the health department does not have any vaccine in stock. We have been approved to be a vaccinator, and we are working through that process to order vaccine and get it into our office. But at this point, we do not have any in stock. Currently, the CDC recommends that COVID-19 vaccine go to healthcare workers and residents, and especially in our long-term care facilities. So anybody that has face-to-face contact with their patients, that's who is targeted in that first phase that's coming out, that they're working right now. There is limited supply of that COVID vaccine. That's part of why they're rolling it out in phases, making sure that we have the folks that need it most are in this first phase. And then as we get into the weeks and upcoming months, there will be more and more vaccine that is available, and we'll be able to open up those phases as those come in. The vaccine does not cost. Some providers may charge an administration fee for the vaccine whenever you actually come in to get that immunization, but there is no charge for that vaccine. And we currently have 2 that are approved under that emergency use authorization. There are many more that are still in development and still in testing. I'm sure we'll see more come out throughout next year, but currently there are 2 available under that emergency use authorization. And we're very excited. Vaccines are a big step, but it's not the only prevention method that we have against this pandemic. This does not replace all of our other measures that we're using, our social distancing, our hand washing, our masks.
Perfect. Okay, so this kind of shows a little bit about where we're at with those 2 vaccines.
Yeah, so just mentioned that EUA, that emergency use authorization. So Pfizer and Moderna are the current vaccines. They have gone through their phase 1, 2, and 3 trials, have submitted to the FDA and been approved for that emergency use authorization. They were about a week apart. And then it goes to the ACIP, and that's the Advisory Committee on Immunization Practices. And they look over that EUA and the vaccine itself, and they're the ones that give the recommendations and the guidance on who should be vaccinated and what timeframes that we're using.
Perfect. Okay. So when can we get the vaccine? So
This one.
Sorry, I don't know what it's hard to see. I can't see you guys on here, so I'm not sure who's taking this one. This is from the state, the MoDHSS website. This is the vaccine availability chart. So it's in different phases. And we're currently in phase 1A, right, ladies?
Correct.
Okay.
Correct, 1A. So again, looking at those long-term care facilities and healthcare workers that are patient-facing. One thing to note, I think we'll say later, but I just want to make sure we don't forget, those long-term care facilities, there is a federal program in place specifically for our skilled nursing, long-term care. They are actually going to work with pharmacies, and in our area, it's Walgreens and CVS, and they will have a direct partnership with those pharmacies to get their vaccinations. So that's really exciting for them.
Okay. And then, yeah, I think you actually just alluded to that, the skilled nursing facilities. This is kind of a bigger breakdown of who falls into those categories, right?
Yes. Yes. And all of this ever changing. We know that as we get more guidance, as everything comes through and we're getting our vaccine in, all of this could change some, but this is what the state and the CDC is working off of to try to make sure that the limited stock we have gets to who needs it immediately and then go from there.
And just as a disclaimer too, these two charts that were in the last two slides, those are also on that COVID vaccine for the COVID Mo vaccine. I can't remember the exact URL, but it's at the end of this slide and I'll link it in the comments as well, just in case anyone wants to be able to look into those a little bit differently. So Melissa, can you give us a little bit of the rundown on mRNA vaccine?
Oh, you're muted.
You might be muted, Melissa.
Thanks. So even though mRNA may be a little bit of a newer term for some in the vaccine realm, the good news is that the process for mRNA vaccine mimics what naturally happens in our cells on a regular basis. So a couple of things that we've gotten questions on. With the current vaccines, both of them, both Pfizer and the Moderna, are mRNA vaccines. They do not have live virus in them. That means that you cannot get COVID from the vaccine, okay? I know that question has been asked several times. There's also some questions about how mRNA works, and the next slide will kind of go through that process. There's questions about, will it interact with our own DNA in our cells? So the mRNA process, like I said, it's a natural part of the way our cells produce proteins. But they do not, with this vaccine, go into the nucleus to interact with DNA, okay? Brianne, I've got a gray block over the next one.
Sorry.
So just very basic, the process is that the mRNA vaccines teach our cells to make a protein that triggers an immune response, okay? That immune response causes the creation of antibodies, and then that our body remembers so that if we get exposed to that virus in the future, that immune response kicks in, okay? So even though the vaccine technology may be a little newer, the mRNA process and using it in different ways has been around for a really long time. Scientists have been studying mRNA technology for decades. And it has actually also been used in different types of treatment.
Okay. There we go. Next slide.
Okay, so this kind of walks through the process. So basically with the two vaccines that are approved for emergency use, the mRNA is inside a lipid particle. The mRNA is kind of like a recipe. So once that recipe enters the cell, our cells convert it to a protein. That protein is similar to the spike protein that's found on the surface of the COVID virus. So once that gets displayed on our cells, that protein, then our immune system recognizes that protein as something different than what is normally in our cells. And it kicks in an immune response. Our B cells, our T cells, it creates antibodies. And then that creates the immune response that will allow immune response in the future if you're exposed to the virus.
Okay. All right. So here's some basic information about the Pfizer vaccine specifically. Gina, is this one you?
Yes, and I'm muted. So Pfizer is the first vaccine that had that EUA approval. It is approved for anybody over the age of 16 and anybody that doesn't have an allergic reaction to any of the ingredients in the vaccine. So that's who it's targeted to. It is a 2-dose vaccine that need to be given at least 21 days apart. And the side effects are pretty similar to most vaccines. So pain at the injection site, tiredness, headache, muscle pain, chills, joint pain, and fever.
Perfect. All right, and then the Moderna vaccine.
Yeah, so a lot of similarities with the Moderna vaccine, but there are a few differences. For Moderna, it has the approval for individuals 18 years and older who are not allergic to any ingredients of the vaccine. Okay, so that's who can get it. It is also a 2-dose administration, and it's 28 days apart. So just a few differences from the Pfizer vaccine. Side effects for the Moderna vaccine include pain, tenderness, and swelling at the injection site, tiredness, headache, muscle pain, chills, joint pain, nausea, fever.
One of the things I don't think we go into later is when you are getting it vaccinated, to make sure that you're staying with the same producer of the vaccine. So if you get Moderna first, you need to get your second dose with Moderna. If you have Pfizer first, then your second dose is Pfizer.
Perfect. Yep, that's a good point to make. Okay, so we're kind of going to jump into some of the frequently asked questions and then some of the questions that we've been getting through social media or emails and things like that. So the first one is, who should seek medical advice before being vaccinated?
Okay, so this is a good question. And just because you seek medical advice doesn't mean you can't get the vaccine. But we do recommend women that are pregnant or breastfeeding, talk to your primary care provider before getting that vaccine. Anyone who has a history of severe allergic reactions, anyone who's immunocompromised, and individuals who have bleeding disorders or on blood thinners. So anybody in those categories, it doesn't mean you can't receive the vaccine. It just means you need to make sure that you talk to your medical provider first to make sure that you're at a place that's best for you to get vaccinated.
And then Melissa, you might be the person to clarify this too, but there's sometimes confusion on social media, the difference between like immunocompromised and people who have like comorbidities or a pre-existing condition. Can you maybe clarify that just a bit so people understand?
Sure, there are certain conditions that based on diagnosis may compromise your immune system, meaning that it may not be functioning at normal capacity, okay? And so that is a little different than having some type of, other diagnosis or background health condition. So if you have been diagnosed with a condition that causes your system to be immunocompromised, that's when you would want to seek advice from a healthcare provider to see, is this vaccine going to be acceptable for you, and will it work appropriately in your system because of your condition?
Right. Perfect. Thank you. Okay, let's see the next question. If you have allergies, can you get the vaccine?
Okay, so if you have food or other allergies, you can still get the vaccine, but it's recommended that there's an observation period after you receive the vaccine. And there's an observation period for every person who's getting it. So, that's going to be part of our normal process when we deliver the vaccine. However, if you are allergic to any of the ingredients in the vaccine, and we will have those posted on our website, and the links that we have at the end of this presentation will also have information on the emergency use authorization with the ingredients for each approved vaccine. So anyone who is allergic to any of those ingredients should not get the vaccine.
Okay. Next question. So we kind of answered this one. Where can I find a list of the ingredients in the vaccines? Like you said, those are all in the EUA fact sheets, which those will be on our website. And then they'll also be listed on all of the additional resources that are listed here.
Yeah, and every vaccine that goes through that EUA process will have a fact sheet with it. The ones that are out for the 2 that we have, I think are almost 5 pages. So there's a lot of information in there for you to go through. So most questions can be answered by those fact sheets, but the ingredients are listed there as well.
Perfect. Okay, so we kind of answered this one too, but should pregnant or breastfeeding individuals get the COVID-19 vaccine?
So there is limited data available for these individuals and how they respond to the vaccine. There's no contraindication on the current approved vaccines, but it is a good idea if you're pregnant or breastfeeding that you follow up with your healthcare provider.
Okay. Can I get vaccinated if I am currently on isolation or quarantine?
Yeah, so we are asking folks not to be vaccinated during isolation and quarantine. We don't want you to break that isolation or quarantine. You're there for a reason. And so for the biggest reason, the health and safety of our vaccinators and anybody that you would come into contact while you are going to get your vaccine, you really do need to remain in your isolation or quarantine period for the full period. And once you've completed that, then you are fully able to get that vaccine. We just want to make sure that you do stay in during those periods in case you are still infectious. There is an exception to that, and that is in our long-term care facilities. They kind of are an outlier on a lot of things, but we will allow for that vaccination. We want to make sure we get that population taken care of. And we have all the precautions when we go in there, when the pharmacy goes in there. So that is the exception to that.
Next question is, how long will the COVID-19 vaccine protect me?
Yeah, so right now we're still awaiting data on how long that immunity will last from both of the vaccines. But even though we don't know exactly how long it'll last, we know that with vaccines, once your immune system kicks in, it can create long-lasting immunity. We just don't have the timeline specific to these 2 vaccines yet.
What other vaccines are mRNA vaccines?
So right now, there's nothing that's approved that is listed as an mRNA vaccine other than the 2 for the emergency use authorization. But it has been studied for a really long time. It's been studied for things like flu, Zika, rabies, and CMV.
Okay. Excuse me. Okay, so is the vaccine effective at preventing infection? $1 million question.
Yeah, so this is also information that is on that fact sheet for each of those vaccines that's been approved. And every vaccine is going to have a little different effective rate. Pfizer is claiming a 95% effective rate, and Moderna is claiming a little over 94% effective rate based on their clinical trials and what they saw in those clinical trials. The current vaccines allow for individuals who've received the vaccine to produce that immune response to the virus. So that allows our body to stimulate their immune response if and when they are exposed to the COVID virus. So it acts in the same way as other vaccines, just a little different pathway for the mRNA, but where the effective rate for each based on those clinical trials is very promising.
Okay. So one of the other questions is, what is VSafe?
Okay. So VSafe is really a neat tool that we have. It's a smartphone-based health checker for people. We're asking folks that when you are vaccinated, if you register in this VSafe, and it will send you daily alerts to see how you're feeling. So it's kind of a continuation of those trials to really get more data on if somebody has, soreness at the injection site and what's going on, and it follows you for a pretty long time. And so that it's really a neat tool that we have. I don't know that I've seen that for any of our other vaccines. Sorry,
Let's go back.
I was going to go right into the next slide.
And I move there. Okay, so how are adverse reactions reported? We've had a couple of those questions.
Yeah, so that VSafe is one of the ways you can do that. It's pretty instant. There is also an institute, VAERS, and that's where all adverse reactions get reported for any vaccine that's out there. And providers will report directly to them, but individuals can also report those symptoms. So we've left that website up there. You either do it electronically or in paper form, I believe. But that option is out there for any vaccine that you receive.
Mm-hmm. Are people who are vaccinated required to enroll in VSafe?
I thought this slide was next. No, you are absolutely not required to enroll. It is completely at your discretion. If you do, it's added data that helps, everything that goes down the line, but you are absolutely not required to do so.
Okay. So we've had this question a couple times too. What about the Bell's palsy that some patients have reported after being vaccinated?
Yeah, so what we know right now about this is that during the clinical trials, there were a few individuals that developed a temporary form of facial paralysis called Bell's palsy, okay? The FDA has looked at it. The FDA said that the rate in which that had happened is no higher than would be expected in the general population. So even though they were in the clinical trials, it doesn't necessarily mean that the vaccine caused that situation. The FDA, like I said, recognizes that it happens in the general population at a certain rate, and their feedback is that the rate it happened in these clinical trials is similar to what we would expect in general population.
And then this was another question that we got. Can you explain why some falsely tested positive for HIV?
So this was very specific to a trial from Australia, okay? There were some participants in this clinical trial in Australia, not Pfizer or Moderna. These individuals had false positive HIV test results. This vaccine was using some proteins, tiny particles that were similar to the HIV virus. So they kind of anticipated it, and they were doing the test to see if this would come up. So this actual trial has been halted. It hadn't gone any farther because they didn't want it to impede diagnosis of HIV or cause any problems in that realm.
And just to clarify again, you said it before, but this is a different vaccine. This is not the Pfizer or Moderna. This was a completely different vaccine that was being trialed, and it's halted currently. So just want to clarify.
That is correct.
Just want to
It was
clarify.
isolated to the single vaccine trial.
Perfect. Okay, so in Missouri, educators are in 1B, according to that chart that we just showed up a bit earlier. Someone wants to know if educators are able to get on a list. Is it coordinated through the schools, or what does that look like when it comes time to vaccinate?
Okay, so first, you can always check with your local providers when we get to these phases. We will not be the only ones that are providing this vaccine. We have a lot of other local providers that are going through that vaccinator process. But internally, we will have a registration process, and we will the idea is to have those large scale community events you would register for. We will have them scheduled out. You'll know where they are, when they are. But especially for schools, there may be an internal process. They may stagger vaccines. They may have a a priority group based on the priority group that they are working with. So always go through your school administrators, your superintendents. They are going to have an internal plan, but we absolutely are planning and ready to go for that 1B when it comes out, and you will have the opportunity to come through those vaccine clinics.
So that kind of leads into this question. Where do we go to get our vaccines, and what's the order in getting them?
Yeah, so like I said before, we're not the only ones that's going to have it. Check with your local provider. It may be an easier route for you to go through your regular physician that you see. And I believe that there's going to be Missouri, the Department of Health and Senior Services has a website dedicated just to vaccines, to the COVID vaccine. So there will be a lot of information there on when and where to go. But internally, again, we're going to have a registration process, and we will be having those clinics as soon as we have the ability to do so, once we're in the right phase, and once we have that vaccine in. But at this time, again, we don't have vaccine in-house.
If I get vaccinated, do I still have to wear a mask and social distance? So I think this one was one I was taking. We get this question a lot, and yes, the answer is yes. Preventative measures are still important to protect against COVID-19. The experts are still learning about protection from the COVID vaccine, as Melissa kind of spoke about earlier. So it's important to continue following all of those precautions. The more precautions we have in place, the better protected we are. If the vaccine went through all of the standard tests, why does FDA state, quote, the Pfizer BioNTech COVID-19 vaccine has not undergone the same type of review as an FDA approved or cleared product, end quote?
So this is a good question because the two vaccines that have been approved are under emergency use authorization. And this isn't the first time this has happened during the pandemic. So EUAs have been authorized for testing, for treatment, and now for vaccine. So basically, they have gone through the phase 1, 2, and 3 trials. So the ones that have had the EUA approval have gone through those same trial phases as routine vaccines. The timelines may look a little different because of some of the phases may have been allowed to overlap, which decrease the timelines. But during a public health emergency like the COVID pandemic, the FDA is allowed to review things and put out treatment, preventative medical vaccines, and to be able to help diagnose. They're allowed to issue those emergency use authorizations for what's in the best interest of the general public and the communities.
Okay. So we've gotten this question a couple times too. Is it true that Bill and Melinda Gates will use the COVID-19 vaccine to collect human biometric data that will be uploaded to a cloud environment and connected with cryptocurrency? So the state actually references this too on their website, which again, that link will be in the end of the presentation, but there is no tracking technology involved in the COVID-19 vaccine or any vaccine. Bill and Melinda Gates Foundation have been involved in philanthropy and public health for years. There's no truth to this rumor. Let's see. Okay, so these are the additional resources we have. So the CDC, this is the CDC webpage that'll take you directly to the COVID-19 vaccine information page. This is the FDA's vaccine, specifically COVID vaccine information page, is where you can find additional information with those EUA fact sheets, the emergency authorization information. They have more about like what that timeline looks and specifically what makes it different. And then this is also the Missouri Department of Health and Senior Services. This is that website that we've alluded to a lot that also have the graphics on the phases for vaccine availability as well. So I'm going to click stop screen share. There we go. Okay, so I think for the most part, we've had a handful of questions that have come in, but they're all ones that we've addressed in here or that can be addressed on those websites. So definitely encourage folks to visit those websites, and I can throw them in the comments after the video. We're also going to put this video on our YouTube channel and our website. So it'll be there hopefully within a couple hours. I'll get it up and running. I think this was really great. We were able to answer a lot of questions and kind of put that out there in the video format and address things before the holidays. So I appreciate your time, ladies. Anything else you guys wanted to add or before?
So I just wanted to remind everybody that, we're getting new information on a daily basis. So what we have given here is what we know today. It could be different tomorrow. So continue to use those resources that Brian put. That state site for COVID vaccine has a lot of really good information. They also have a section on facts where they're adding rumor control information on there. So definitely check that out and check out those other sources, and we will try and keep you as up to date on information as we can.
Yep. All right. Well, then I'm going to say that is it for this evening. So thank you guys for joining us. Happy holidays, and we'll see you soon.